Have you ever found yourself wondering, perhaps in the quiet of the night, if it's still acceptable for you to do this every day? Not because of guilt or shame, but simply because it's a question that most men are too afraid to ask out loud. If so, know that you are not alone. There are thousands of men over the age of 50 and 60 who carry this same question in silence. We openly discuss our blood pressure, cholesterol levels, testosterone levels, and even our sleep patterns. But when it comes to self-pleasure, there is often silence, hesitation, and confusion. So let's address this question directly today. What really happens to your prostate if you masturbate daily after the age of 60? Is it silently harming you, as some rumors suggest, or is it actually protecting you in ways that you have never been told? Stick with me, because the science behind this may surprise you. By the end of this video, you will understand how to make this private habit work for your long-term health rather than against it. But before we dive into the science, I have a quick favor to ask. If you are watching this right now, please take 2 seconds to hit the like button. This helps more men see this important conversation. And don't forget to let me know in the comments where you are watching from today. I always love hearing about the different places that this community reaches. For decades, men have been told all sorts of things about masturbation. Some say it drains your energy, others claim it causes prostate inflammation, and the scariest rumor of all is that it increases your risk of prostate cancer. But here's the problem. Most of these so-called truths are based on fear, not facts. Some of these myths and misconceptions about male sexuality have been passed down through generations, while others were based on outdated medical beliefs. However, when fear and ignorance take the place of scientific knowledge, men may stop asking important questions and suppress their own biology. This can lead to avoiding behaviors that could actually benefit their health. But the good news is that we no longer have to rely on these myths. Today, I will share with you the truth about daily ejaculation and aging based on scientific research. I will explain it in the same way I would to a patient sitting in my office, without judgment, but with clarity. I have been practicing medicine for over 7 years, specializing in men's health and wellness, and I can tell you from personal experience that this is one of the most common questions men ask me in private. They may not bring it up during their annual checkup, but as soon as we are alone, they lean in and ask, "Doc, am I harming myself by doing this?" So let's dispel these myths with real science. In 2016, Harvard University published one of the largest and most reputable studies on this topic in the journal JAMA Oncology. The study followed over 31,900 men for more than 18 years, most of whom were middle-aged or older. The researchers asked a simple question: how often do you ejaculate? Then they tracked the development of prostate cancer in these men. The results were surprising. Men who ejaculated more frequently had significantly lower rates of prostate cancer. Specifically, males who ejaculated 21 times or more per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. This is not a small difference, but a life-changing one. Let's take a moment to pause and reflect on this. This wasn't just some random internet survey, but a study that was peer-reviewed and controlled for factors such as age, lifestyle, and medical history. The researchers had no ulterior motives. They were simply following the data. And the data told a clear story. More frequent ejaculation was actually protective, not harmful. But why is that? How does daily ejaculation actually benefit the prostate? Let's break it down. Reason number 1, it clears the pipes. The prostate's main function is to produce seminal fluid. When ejaculation does not occur for extended periods of time, this fluid can build up and become stagnant. This can lead to increased oxidative stress and create an environment that is prone to inflammation. Think of it like a garden hose. If water is left sitting inside for weeks, bacteria and debris will collect, but when fresh water is run through, it clears out the hose. Daily or frequent ejaculation works in a similar way, flushing out old secretions and keeping things clean and balanced. Biologically, this reduces pressure on the prostate. Emotionally, it can bring peace of mind. And practically, it may lower the risk of uncomfortable conditions such as prostatitis. Reason number 2, it lowers inflammation and stress hormones. When a male orgasms, the body naturally reduces cortisol, the stress hormone. This is significant because as men age, their bodies produce more cortisol, which can lead to chronic inflammation. By ejaculating frequently, the body is able to reduce cortisol levels and lower the risk of inflammation. This can have a positive impact on overall health and well-being, especially for men over the age of 60. But wait, there's more. Ejaculation also releases endorphins, the body's natural feel-good chemicals. These endorphins can help reduce pain and improve mood, making ejaculation not only beneficial for the prostate, but also for overall physical and mental health. And let's not forget about the physical benefits. NET. Regular ejaculation can help strengthen the pelvic floor muscles, which can improve bladder control and sexual function. So why is there still a stigma surrounding male masturbation and ejaculation? One reason could be societal norms and expectations. Many men are taught to suppress their sexual desires and to view masturbation as something shameful or dirty. This can lead to feelings of guilt and shame, which can have a negative impact on mental health. However, as the data shows, masturbation and ejaculation can have numerous physical and emotional benefits and should be viewed as a normal and healthy part of male sexuality. In conclusion, the study's findings are clear. Frequent ejaculation can have a positive impact on prostate health and overall well-being. It's time to break the stigma and embrace the benefits of male masturbation. So go ahead and take care of your prostate, your body, and your mind. It's all connected. Because high levels of cortisol are associated with chronic inflammation, elevated blood pressure, and weakened immune function. Research from PubMed and the NIH has shown that having a balanced sexual activity can lower systemic inflammation. This is especially beneficial for men with enlarged prostates, where inflammation plays a key role. However, the benefits of regular ejaculation go beyond just biology. Emotionally, it can lead to lower stress levels, resulting in calmer moods, better patience with family members, and a stronger sense of control in daily life. The third reason why regular ejaculation is important is because it supports blood flow and nerve health. As we age, our blood circulation naturally decreases, which can affect not only erections, but also the health of pelvic tissues. Ejaculation stimulates blood flow throughout the entire pelvic region, keeping nerves firing, tissues nourished, and blood vessels flexible. It's like exercise for your reproductive system, and just like your muscles need movement, your prostate and nerves do too. This can lead to better urinary function, improved sexual function, and less discomfort. The fourth reason is that it helps maintain hormonal balance. Our bodies are not just mechanical, they are also hormonal. Regular ejaculation helps keep testosterone and related hormones in balance. When our hormones are balanced, our energy, mood, and even motivation can improve. Many men have reported feeling lighter and more relaxed after ejaculation, and this is not just in their head, it's due to the chemistry in their bodies.